Health Tech listeners, I'm your host this week, Justine Abson. This is the podcast where we tackle some of the trending topics, ideas and challenges across health and social care. This week, we're speaking to Olivia Sykes. Olivia is Radar's Healthcare's events manager. So Liv looks after everything from planning events, exhibitions, which speakers we kind of get there, the day-to-day job of who's going to actually be there. It's definitely safe to say that we wouldn't know what to do without her when it comes to the huge job of organising these. Outside of work, Liv is mum to 2 boys, Harry who's 4 and Otis who's 3. In fact, she even ran the London Marathon when 4 months pregnant with Harry, which I think is just crazy, Liv. They love trips to the seaside, family holidays to the Isle of Wight, which usually involves the music festival. Very jealous of that. And is looking forward to a skiing trip, getting the boys onto the slopes in the future. So, Liv, sounds like you have a busy life outside of work, as much as inside.
Absolutely, yeah, it's all about pace, I think.
Well, welcome to What the Health Tech.
Good to be here.
So we're going to start off by discussing a little bit about your role at Radar Healthcare, what events we kind of do and how the planning starts. So as our events manager, the role was only introduced in April last year. It was a brand new role. So why do you think it's important to have a focus on events within the healthcare industry in particular?
Yeah, so I think it's hugely important and just brilliant that Radar Healthcare recognises that. I think events are all about building a brand and putting a face to the brand and a bit of a personality around it as well, and having a dedicated focus on events really enables us to strategically plan which events we should be at and support the teams that are involved in events as well. And yeah, I think it's all around building who we are as a brand and that we are a friendly brand, and that's sort of really aligned in the healthcare sector.
Yeah, I think that definitely comes across as well, doesn't it? You know,
Yeah.
like we get a lot of the teams involved in these events as well. So it's great that everybody kind of comes together and to meet potential customers and our current partners as well.
A real team effort, isn't it? So yeah.
Fantastic. So events come in all different forms. There's your large ones like the Care Show, NHS Confed, Patient Safety Congress, you know, just to name a few. But there's also a lot of smaller options dotted around. Do you think they're all as important as each other when it comes to thinking about where we're going to be?
Absolutely. I think it all depends on the events you attend, all depends on what sort of resource you've got, how many sales members you've got, how many people you've got across other teams that are needed to collaborate and sort of come together to bring, you know, what we want to do at an event to life. And I think some of the smaller events, certainly ones to consider, they can be really key in facilitating more sort of in-depth conversations that can be really valuable, and might be that one conversation in front of an influencer or decision maker that's involved in driving change in an organisation, and sometimes that's all you need. So obviously really worthwhile. Also puts your brand out there across a range of customers and prospects. So you think of our partners, we work with care settings with maybe a single site care home to over 200 plus care homes. So, you know, you've got a real sort of range to be looking at in terms of who you're reaching out to and building your brand and your awareness of the business. So
yeah, that's it, isn't it? There's so many things that you could be at. And I think that's regardless of whatever sector you work in as well. There's so many events that you could attend as a business that could be useful, and you might meet the right people. It might have different jobs. You know, there's so many different things.
Yeah.
So I think like what should businesses look for, I guess, when they're looking to attend certain events? So like, are there kind of certain things that you think they should focus on, for example?
Yeah, so I think the common theme, particularly in healthcare, is we're looking to make a difference and we're looking for value added, whether that's health tech, whether that's sector knowledge, new legislations. But I think for building an event strategy in a business, certainly I think you need to be linking it back to your business objectives, aligning with your business goals and where is the business going. So are you going into new markets? What are you focusing on right now? What are you looking to focus on in the future? So I think when you're building a strategy, it's not just about the next month or even the month after that. It's really trying to have a view for for the year, and obviously things always crop up. You always get last minutes, or gosh, we missed that, we really need to be there, and you make it happen. But yeah, I think it's how you want to position yourself for the year, really, and being able to resource that, to create a real impact. I think you're looking for quality, so is the audience right, and if so, are the right people there that you need to be talking to and in front of. I think there's more to an event than just lead capture, so you might want to think about, so maybe not so much networking and lead capture, maybe more of a thought leadership position. So are there some opportunities to get involved with speaker sessions or roundtable discussions, which is something we do a lot of at Radar Healthcare. And again, it just might position your business amongst the influencers and the people that are driving change in organisations.
Yeah, I think that's really important, that bit about going back to your objectives as well, because I think so many people forget about those, and it's almost that, why are you doing it? What is the point in doing it in the first place, and what do you want to get out of it? And I think people forget to kind of go back to that, and they sort of concentrate on, oh no, it looks cool, we'll go along to that.
Yeah, and I think that's where researching the event really comes in. Is it offering that opportunity to grow your business and put your brand out there? And in addition to that, is there also some scope there to learn and to sort of get to know your partners as well? Because I think that's a big thing. Getting to know your market more, and the events are really good for that. There's not many times when the sector, you look at the care show, there's a huge range of different types of suppliers, different customers, health tech providers in the room, and I think there's a lot to be said for coming together and sort of really seeing that come to life.
Yeah, I mean, you sort of touched on there about learning as well. And there's always something new. We work in technology, of course, there's always something new in tech. But I think even across health and social care and, the journey on going digital and kind of understanding what's right for your business. So kind of like attending events sort of help visitors to see what's new, maybe overcome some challenges they're facing and things like that.
Absolutely, yeah. And I think that's key for some of the speaker sessions and roundtable discussions that you can get involved in. It's really good to see another organisation's vision and maybe how they're bringing in health tech or sort of dealing and managing new legislation. For example, we did a speaker session last year at the Care Show. That was hosted by our Chief Revenue Officer, Simon, and a partner of ours, Anthony Hall from HC1. And really, the talk was all around organisational learning, digitising systems and driving change through insights, but moving away from a real push on compliance to focusing on quality. And I think it really resonated with a lot of people in the room there, that it was all about driving better outcomes in care, and that prompted a flurry of traffic to our stand to wanting to know more and wanting to know more about Radar Healthcare, wanting to know more about the partnership approach between ourselves and HC1, and yeah, I think that's if you can create something like that people want to be a part of, then that's really key.
Yeah, I mean, I was at that talk, and I think the bit that really resonated with a lot of people in the room was it doesn't matter what size of organisation you are. There was something within that about that organisational learning, and there was better outcomes, that you didn't have to be a multi-site care provider. You could just have 1 or 2 care homes, but there were still certain things that they talked about that you could implement that could make a difference. So I think that kind of, when you're in those speaker sessions, I think there's always those little golden nuggets almost that somebody in the audience can take away regardless of who they are. Yeah,
and there's always one thing, isn't there? I think if you're attending as an organisation, it's really good to try and spread your people out a little bit across the event and bring those learnings back afterwards.
And that brings me on really nicely to my next question, which is all about networking. So I can imagine, some of these events are absolutely huge. And I think the networking side is really important. So, speaking to people that are in the same industry as you, sharing best practice as well with people that you might not normally, kind of meet up with or be able to talk to. So what advice can you offer people that are coming along to the event to get the most out of that side of things? And how can they, I don't know, maybe learn and take things back as well?
Yes, I think do your research. If you're going to an event, maybe, a couple of weeks in advance, start having a look at what's going to be discussed at an event, who's there, and in terms of exhibitors, who's there in a speaking capacity, and try and plan your time well, really. Is there a particular new legislation that you want to hear about? For example, our next show in March, we're going to be talking a lot around PSERF, which is obviously coming in October. And, I think that's obviously really valuable for attendees. And sort of the key theme across the attendees is that we're all looking for better healthcare outcomes. So yeah, I think keep that in mind, but do your research and planning early on.
Yeah, there's definitely that common goal, isn't there, that everybody is looking to, visitors in particular are going to be looking to how they can make a difference to their patients or residents. Suppliers like ourselves that are going along want to know how we can help them to make a difference, how we can help that, that better healthcare in general. So I think it is really interesting because you mentioned earlier there's lots of different suppliers at these events, and they're not all in the same, same kind of industry, if you like, but they actually all are working to that common goal.
Yeah, absolutely. Yeah.
So let's move a little bit on to maybe the planning side of it, which, I know is a massive part of your role. So what do you get involved in, and how do you kind of make the decision on which events Radar Healthcare attends?
Yeah, so involvement in events, I'd say, a bit of an all-rounder really, from initially booking the event to booking hotels and even the staff meal out maybe, so it's a real, I think the events manager's role is definitely varied.
That staff meal's important. Everybody forgets about that till the end.
Yeah, and I think in choosing which events you want to be at and building your strategy, I think it's clear what events you have to be at as a market leader. You've got to look at where your competitors are, where sort of the thought of events are in the sector as well. There's always some key events that you kind of just have to, we need to be there. But then I think it's about researching new events that you maybe keep hearing about, that are the right sector, they're the right audience. And I think it's just getting a bit more into the detail of who is the audience, are they the right attendees, down to the job title, is anybody attending that you're in conversations with, to promote, that prospecting side of things. But also, I think it's important to research the quality of event supplier as well. Look for some case studies, have a look at social media, at past events. Is there anybody there that you're either connected with within business or that you maybe approach and find out a little bit more, or are any of your partners appearing in past events, and just start building a bit more of a picture of what the event is going to be like, because it's not an easy thing, and events aren't cheap, they're quite costly, and it's a big thing just to say, right, we're going to do this new event. So, and sometimes you have just got to go along and try things. I think if you can go along and try an event in a sort of smaller capacity, before you really, book a stand space, 3 speaker sessions, and, put a lot into it, I think if you can do that, then great. So that's sort of how I approach where we need to be for the year. But also it comes a lot down to budget. I think when you're building a strategy, it's about looking at strategy for the year. Lots of things come with events, stand, speaker sessions, how you want to look, that you've got a service for the year. So it's, you know, one event is, you're then going to have the costs associated for the rest of the events for the year. So yeah, and I think this year it's been particularly challenging with rising costs. Just done a huge piece of work and bringing a sustainable option for our exhibition stand. And I'm really looking forward to see it come to life. But it's not just buying a new stand, it's how it's going to be serviced for the year and how interchangeable it is going to be for the rest of your events, and to sort of create a cost-effective and environmentally friendly option as well.
Well, that's it, isn't it? You don't just want to kind of, you know, obviously there's the cost involved, but equally, you know, you do want to be sustainable. You do want something that you can reuse that, you know, we do a lot of events across the year, which is why we brought your role in the first place. And the time that goes into creating the stand itself and configuring it and things like that, you know, not every event space is the same either.
No, that's a thing. You've got to think, right, well, it's going to look like this at one event, but how could it look at, you know, event 4 and 5, and can we switch things up a little bit come the end of the year if the need arises. So yeah, there's certainly a lot to consider. I
guess that's where working with, you know, trusted suppliers and things like that as well really, really helps, because you need to work with someone that you can have those honest conversations with if something's not quite right, or how are you going to reuse certain elements of it. And I think they're the bits that sometimes people forget about in events. There's obviously the smaller shell schemes that you can take. So, you know, if you are going to test it for the first time, you don't want a big exhibition space, then there are options, aren't there?
Yeah, definitely. And I'd certainly say that, you know, bringing a bespoke build stand is a huge thing to sort of manage for the year. And there's lots of other little things that come into that as well, you know, even electricity and internet supply. It's just, there's so much to think about. And building that relationship and having more of a partnership approach, as we do with our customers, is what I sort of I think we all do. We pride ourselves in building partnerships with our suppliers. I mean, probably should say a huge thank you to Starter Media in helping me bring in the stand to life. Really aligned with our brand. We see they know us inside out, our, you know, all our brand and our colours, and it's the first stand will be in situ in March at Digital Health Rewired. So hopefully everybody likes it.
Very exciting. I can't wait to see it. What about internal events? Do you get involved in organising internal events at Radar Healthcare, and what's your kind of view on those in terms of, you know, how important are they compared to external?
Hugely important. I think the internal events, they're really good for bringing the team together and team building, getting to know your colleagues, but also just creating a sense of being a part of something. And I think that's really important. It's all about working together, and you could do that sort of with your internal events, you know, and it's still about selling, you know, putting the brand across, and who we are and how we want to be perceived. And I think the internal events are very good for that, especially sort of like company meetings, you know, business updates, things like that. I think hugely important for the vision of where we're going.
Yeah, definitely. I think it's so nice to get everybody together as well, and get everybody sort of on the same page, and, you know, especially when you don't work in the office full time as well, and we have lots of people across the country, and it's a nice way to kind of bring everyone together and kind of celebrate successes as well.
Yeah, absolutely. And I think that's one thing that at Radar Healthcare we all definitely enjoy, sort of coming together for the internal events, and we always tend to have a really good time. So there's obviously that added as well.
So obviously there are so many events across health and social care. It's absolutely impossible for everybody to attend everything. You know, we know there's so many time constraints on, you know, within the industry and people's day-to-days. But I still think it's important that people do get out and about and see these things. So what do you think people should look for when, you know, deciding which events they are going to kind of give up time, which is something that is quite precious, to go and visit an exhibition?
Yeah, so I think it's important to identify, so for example, is there a pain point within the organisation at the moment that you're looking to overcome or looking to gain a little bit more knowledge around? It might be that you're looking to bring in a new system, patient safety management system, or you're looking to bring in care insights model into your organisation. And I think, it's what are you looking to achieve, firstly? Doing your research on who are the exhibitors, are there any exhibitors there that might offer a solution or offer knowledge? Have a look at the speaker sessions. Again, is there any thought leadership pieces that might really help you? Is there a new legislation coming up that you might want to be a bit more clued upon and bringing it back to your organisation? So I think that's sort of the first step. But also, if you make that decision to attend an event, especially the larger events that might go on for 2 days and they've got sort of sessions running all day, you've got 100 exhibitors, you can't get around the whole event in on your own, or if a few of you are going, it's still a big thing to cover. So I think plan your time well. Pre-book any meetings in if you can before, so you can sort of know where you're going to be and how long things are going to take. And take lots of notes and feed that back to your organisation.
Well, that's it, isn't it? You kind of, if somebody's going, you want to be able to know that actually you can share that amongst your team. I know even within our marketing team at Radar Healthcare, we'll sometimes go to different marketing sort of events or tech events, and we always come back and sort of debrief the team, because actually there's bits that will be relevant, maybe not relevant for our job particularly, but will be for somebody else in the team. So it gives them a chance to kind of almost experience it a little bit without, you having to have everybody there.
Absolutely.
But I think you're right. I think planning it and looking at who you really want to see and making the most of, being able to go and see, you might have been interested in a system, but you've not had time to do a proper demo, for example, but you do want to see it in action. So I think that's where you can go and bring things to life a little bit more.
And then if you are looking to bring in a new service supplier, then you're building that relationship at the event. I think events are great for that. It's a face to the brand.
Well, you get a nice feel for it as well, I think, as well, don't you? You get a bit of a feel for the company and who they are, and some of the people that are involved that you might not deal with if you are, in that sales period, if you like. You might not deal with, the project managers or the customer service team or the support team, whereas actually events give you a chance to, especially with who we send to events, we always get a good mix of people across the different teams.
I was just going to say, for the coverage we have at events, we've got the sales teams there, which predominantly will facilitate conversations, but we've got people from our customer success team. Anyone coming to our stand can get a real insight to how we implement the product, how partnership approach, and what else is on offer as being a partner of Radar Healthcare. It's about building that reputation and that initial relationship, I think.
Yeah, and I know from attending them, everybody that's there always loves it as well. So it's always a nice feeling, I think, when you're there.
It is, it certainly brings the team together, doesn't it? So
yeah, definitely. So what about top tips? So any of our listeners that might be listening in terms of, they're thinking about planning their first exhibition, they're kind of, they don't really know where to start from corporate event type of a space. They might not even have a dedicated events manager, but they do want to start and get out there. What are your top tips for where they should start?
Yeah, I'm not going to sort of hide the fact that sometimes with event management, it can be a little bit, where do I start? I often think that it's sometimes feel like you're solving a problem that you did not know you had in a way that you don't understand. But having said that, been doing this, in on to 8-9 years now. So obviously you start to pick up on what you need to be doing and when and always plan a little bit further in advance. But my top tips, I think, is planning for at least 3 months in advance, having a vision for the rest of the year. I've said you can easily sort of run into barriers if you're sort of doing event planning, event by event, without a view or at least a vision for the rest of the year. work back from your event date. So what have you got going on at the event? You might just have a stand space or a shell scheme, but you might have a free build space, you might have speaker sessions, you might have roundtables, and I think it's what do you want to do first, and often it's your speaker sessions and your roundtables that you need to be focusing on first if you want to bring in thought leaders into the mix as well, and obviously making sure you can get the dates booked in the diary. So yeah, I definitely recommend looking at those elements first. But yeah, and I think also getting your other teams on board. So events don't happen without people. So you want to be looking at doing a kick-off meeting with the relevant stakeholders at events. So it might be customer success team to get a bit of a feel for what's happening in a particular sector. So, you know, what's happening with our NHS customers at the moment? What should we be talking about? What should we be promoting? Where's the expertise on your team, you know, to help us with that? Also connecting with your marketing campaigns. So again, you want to be promoting what you're doing at an event. So you're putting a lot of effort in. You might as well join up with the campaigns team and run that alongside as well and really get the most out of it. Yeah, so they're sort of my key tips, but I think don't think any less of the small sort of tasks that you need to do. So booking a hotel for your team, get that in early, because they are always expensive around event season and around venues, unfortunately. But yeah, so yeah, as I said, how are you going to get there? What are you going to do on the evening for food? Just little things. But yeah, and I think get all your agencies on board early. So there's a lot. Once you've sort of built up a relationship with a stand supplier, for example, there's a lot of help to be had there. So if you know, it's about just understanding what needs to go into a stand space and know what to ask, really.
Yeah, I think sometimes people forget about there's a lot of health and safety stuff as well that's involved with events, and actually your stand supply can often help a lot with that, but you don't always realise that, and sometimes that can feel really overwhelming, especially if you're not a dedicated events manager. You know, I've worked in previous companies where I've managed the events, but it was just a part of my market manager role, for example. So you're not an expert in it. Yeah. And sometimes you're like, oh, where do I turn to do this little bit? Or who knows that bit about health and safety? But
you don't know what you don't know with it. And yeah, it can be daunting. And the other thing is, lots of venues, suppliers, they all have different rules and regulations. So you think you're on top of it, but it's always sort of double checking everything.
Yeah. If nothing else, just keep calm.
Yeah. And smile.
Exactly. Keep calm and smile. It always works out in the end. So thank you so much, Liv. At the end of every episode, we ask everybody to describe what their health tech moment is. So this question is a bit of fun, weird and wonderful stories around health and social care, an emotional story, anything that's sort of affected you within health and social care. So Liv, what's your what the health tech moment?
Yeah, so probably struggled to pick one, actually. I've had quite a few experiences in healthcare, particularly since I had my eldest son Harry. He certainly keeps me on my toes, but yeah, so I think it's appreciation and perseverance from healthcare. I just keep seeing it, and now I'm actually working in the healthcare sector, it really shines through. I think Harry was diagnosed with quite a rare eye condition at 6 months old, which really affects his vision, and to be honest, it was really a case of not knowing how it was going to affect him, but also at the time it was a little bit, this is kind of what we've got. But the amazing team at Sheffield Children's Hospital, the eye department, they've just completely transformed him, really. It was really a difficult one to know how to treat because it's so rare, but they recognised that his vision was affected in this way, so let's try this. And it's just been unbelievable that he's now 4 years old and seeing really well with his glasses and using both eyes. And I just think, the the support from the team and the perseverance has just shone through. And I think, yeah, obviously I see a lot of it now in working in a sector that we're all wanting to make a difference. So yeah, it's nice.
Well, I think that is a fantastic point to end on. Liv, thank you so much for joining us this week.
Thank you.
And thank you to everybody for listening. Join us next week for another new episode, and don't forget to rate and subscribe. If you've got any questions for our guests, if you want to know more about events, then please email whatthehealthtech@radarhealthcare.com.